a chroeso I Bwyllgor Archwilio Iechyd a Gofal Digidol Cymru. Good morning, everybody, and welcome to the Audit and Assurance Committee at Digital Healthcare Wales. And a very special welcome to Darren Lloyd, who's Associate Director of Information Governance and Patient Safety, and to Marcus Sandberg, Information Governance Assurance Manager, who are attending to respond to queries on the Information Governance Framework. To Sarah Brooks, Head of Culture and People Strategy, who's responding to the Staff Culture and Wellbeing Advisory Review. To Nathan Couch, Audit Wales, joined by his colleagues Andrew Doughton and Mike Whitley. To Isis Hertog-Hirst, Head of Organisational Performance, who is attending her first meeting to present DHCW's response to Welsh Government requirements. And to Carwyn Lloyd-Jones, who's attending to present the Management of Physical Assets report, item 5.7. You will note that we have a full agenda this morning, so in the interest of time, I suggest that you perhaps introduce yourself as and when you make a contribution. We are holding this meeting virtually on Teams. The committee is being recorded and the recording will be posted on DHCW's website. And as usual, papers will be available to access on our website. There will be a short comfort break between sections 4 and 5 of today's agenda, and I'm planning to finish the public session by 12:25 at the latest, with a short break before our private session, which starts at 12:40. Diolch yn fawr. We have one apology for absence, and that's Ruth Glazard, who, as you know, has taken up the interim chair's role at DHCW. We'll move on to declarations of interest. Are there any additional declarations of interest on today's agenda? No, I can't see any hands, so we'll move on then to part 2 of today's agenda. And to ensure that we focus on business critical activity, we will be using the consent agenda. And I'm assuming that you all read the papers under part 2. Can I just check whether there are any issues that you would want to see being removed from the consent to the main agenda for discussion? I can't see any hands up. Okay, if that's the case, then I conclude that colleagues are happy to approve and note all the items as outlined, and specifically we are approving the minutes, item 2.1, from committee meetings held on July the 8th, both public and private committee meetings. We are noting the NHS Wales Shared Service Partnership Committee Assurance Report, that's item 2.2. We are noting the contents of the Forward Work Plan, item 2.3, including items scheduled to come to future committee meetings. We are noting the Standards of Behaviour Report, item 2.4, and the current lower compliance rate for staff banded 8A and plus at the time of writing, which I'm assured is due to the 3-year review period coming to an end and the need for renewal. But we note that work is ongoing to address this. We are noting the Estates Decarbonisation and Compliance Report, item 2.5 for assurance. We are noting the Quality and Regulatory Compliance Update Report, item 2.6. Noting the Legislative Assurance Register for assurance. Approving the Quality Framework, item 2.8. Noting the Raising Concerns, item 2.9. And finally, approving the Consultation and Document Approval Report for the following policies. And that is Policy 17, the Equality, Diversity and Inclusion. Policy 19, the Policy on Policies, Strategies and Frameworks. And Policy 1, the ICT policy for joiners, movers and leavers. So thank you for that. So I'm going to take us now to the main part of today's agenda, and we'll start with the action log. And as you'll see from your pack, there were 2 actions captured from our committee meeting on July the 8th, which I'm pleased to note are both complete. And we are being asked to note the status of the action log, which I'm sure we're happy to do so. So that takes us nicely to part 4 of today's meeting. And we are opening this part with the internal audit progress report. And it's my pleasure now to invite Stephen Cheney, Head of Internal Audit at NHS Wales Shared Services Partnership, to go through the progress report. And following that, there are 2 internal audits for review. Stephen, croeso mawr.
Thank you, Chair. Good morning, everyone. I shall start off today with the progress report, and we continue to make good progress. We actually have quite a number of audits underway at this point in time, with the aim of completing as much as possible by Q4. Whilst we have 3 reports finalised currently, we have another one that's approaching draft report stage and will be complete shortly. And we have several audits that were in planning stage but now have moved to field work in progress stage, or will be shortly. So we're moving forward quite comfortably with the work. We continue to receive good engagement and closures. We bring the audits to a close. So overall, no problems to raise there, other than, as I said, we continue to receive good engagement, and we are pushing forward to complete as much as possible. So all being well, we'll be moving into Q4 with just a small number of audits allocated for Q4 for us to pick up and progress, which should ease pressure for the organisation as well. So that's all I wanted to flag up on the progress report. Welcome any queries or questions on that before I progress.
Thank you, Stephen. That's very helpful. I can't see any hands up, so thank you for that progress report, which we are noting. We'll move on then to the internal audit review reports, of which there are 2, information governance framework and the staff culture and wellbeing report. So over to you, Stephen. Diolch yn fawr.
Thank you again, Chair. So the first report today is an assurance piece, information governance framework, which is substantial assurance. And overall, this was a very strong position and report from the testing that we completed. We found that there's a robust framework in place for information governance. There are resources and effective oversight, given the role that DHW serves. We also found the framework aligns with legal, regulatory and industry standards as well, supported by policies, procedures and clearly defined roles. Training and awareness programs are also well established and consistently exceed the compliance targets. And alongside that, monitoring mechanisms, which include instant reporting and regular reviews, we also found them to be effective in ensuring adherence to information governance requirements as well. We found the Welsh IG toolkit is completed annually, with outcomes informing action plans and continuous improvement taking place. So overall, a very positive position. We raised a couple of medium priority findings. So these are typically ones which are not as urgent, but are areas to review. And these typically followed the same or similar pattern as what we've raised elsewhere across other audits. So the lack of SMART objectives or targets, but it's quite an easy point to rectify at the same time. So the first recommendation concerns the strategy, and as I mentioned, the lack of SMART objectives. We saw quite a lot of work underway, as we would expect, but setting those targets would aid with accountability and clarity over priorities. Likewise, with the IG toolkit as well, as I mentioned, that's completed annually. But there's some scope to improve that process further and set implementation timelines as well, which have been agreed and accepted by management. So, in spite of those 2 points, it is an extremely positive report overall. And welcome any questions or queries.
Thank you, Stephen. I'll open it out for questions. And we've also got Marcus Sandberg here and Darren Lloyd potentially to respond to, well, perhaps I can turn to you first of all then, Marcus and Darren, to respond to the audit findings and management response.
Thank you, Chair. Yeah, I'd just like to reinforce what Stephen has said. We were taken through the process, and I'm pleased to note that we have had substantial assurance as a statutory organisation and meeting those regulatory requirements. Of course, we're also responsible for the toolkit management as well. So we're both inward and outward facing in terms of our IG compliance, which hopefully demonstrates some of our system leadership in this area. We're also trying to help as well as part of the overall audit and assurance process, working with shared services by using the toolkit as the mechanism to actually assess other statutory organisations across NHS Wales. So we're both inward and outward facing as well. But in terms of our own statutory compliance, then there are some areas for improvement, which you would expect. But I'm really pleased to actually put this report forward and to know that fundamentally that we've got all of the correct regulatory requirements in place. There are a couple of things in terms of our strategy, which we are going to take forward into our next strategy, because there is a new revision in 2026 in 2026 for a new revision of the strategy. So that is where we can pick up some of those actions, but also some of our associated action planning. We can prioritise some of those elements as well in terms of where we are in the business, in terms of improve on some of our corporate compliance elements around IG. But effectively, we've picked up a lot of our statutory provisions as we've moved along that journey of becoming a more mature statutory organisation and meeting our responsibilities as well. So I'm really pleased, and the cooperation that we've had with shared services going through the audit as well. It was a really good and thorough process, so I'm very grateful for that.
Thank you. Diolch yn fawr, Darren. Very pleasing outcome, and very good to see the IG framework so deeply embedded across our operations. I'll turn to Claire first, and then perhaps Alistair, in that order. Thank you.
Yeah, I'd just like to say thank you to Internal Audit for undertaking the audit, but I'd also like to thank the IG team. As they rightfully point out, this is an area that we lead in terms of knowledge and expertise, and I think that is really translated into a very usable training competency framework that the whole of NHS Wales can benefit from. And I think this is a particular area of spotlight for us as DHEW. So I think it also reinforces the confidence and capability of that team in delivering such an important aspect of digital and data governance. So I was secretly thrilled, if I'm honest, to see such a green audit report with so many substantial aspects to it. Obviously, there are one or two there, Darren, and the team that you can work on, which I'm sure you'll embrace. But I think it demonstrates the investment in that capability as a national organisation and the benefits that come from that. So thank you both, and thank you, Stephen, for a very comprehensive audit.
Diolch, Claire. Alistair Neil.
Yes, thank you, Marianne, and again, also thank you, Stephen and Darren. It's firstly just to recognise that these are two really encouraging reports, and they don't happen by accident. So it's to to also recognise the huge amount of very good work that lies behind it within the organisation. Very pleased to see those things. It's really more a comment than a question, but it does seem to me that the very nature of your review in terms of staff culture, well-being, apart from anything else, reflects well on the approach that we are taking to dealing with the escalation issues, and the confidence that we should have that we are approaching them appropriately, and have every reason to believe that we'll progress through this period effectively. I don't know if I'm reading that appropriately from what you've reported on, but that seems to be something that we might be able to take out of the strength of positivity in those reports. Thank you, Chair.
Thank you, Alistair, and we will come shortly to the staff culture and wellbeing review. Darren, would you like to respond to that?
Just one final comment, Chair, in terms of the audit report and our work as well from a corporate perspective, because we link in very strongly with our corporate governance team, because some of the actions that fall out of the report are incumbent on ensuring that we have robust processes across our organisation, complying with Freedom of Information Act requests, for instance, and then having publication schemes and all of those things that demonstrate to the likes of the Information Commissioner's Office, and also, more importantly, the public, about our compliance area. So we work really closely with our corporate governance colleagues, and that also demonstrates in terms of that audit report as well. So I just wanted to mention that. I also wanted just a quick call out as well for Marcus, who's on the call, who's been doing a lot of that engagement work with corporate governance and ensuring a lot of that compliance is up where it needs to be in terms of our system leadership elements. So I think that's been really important. I should be recognising as well the work that Marcus has done in order to push up the requirement and get us really to the top of the kind of the assurance areas that we are. So I just wanted to mention that, Chair, and thank you very much.
Diolch, Darren, and thank you, Marcus, and thank you for calling that out. It is very much appreciated. So a very positive audit. But before I draw this discussion to a close, can I just draw our attention to the two information governance corporate risks? There's one on the citizen and stakeholder trust in uses of health and social care data, and the second on the risk around establishment and functions of DHCW. To what is the risk, and to what degree do they potentially limit or impact our ability to go even further to progress with our agenda of continuous improvement in this space? Who would like to answer that? Darren? Yeah.
Sorry, Chair, again, if colleagues are happy for me to give a bit of information.
Please do. Please do.
It is one area that we're tracking very strongly, and Alistair will know this, through the Digital Governance and Safety Committee. So these are long-standing corporate risks. One about fundamentally Digital Health and Care Wales functions and its responsibility for the acquisition, processing and dissemination of Welsh citizen information and patient data. So those responsibilities, and ensuring that there's full clarity in the system on our ability to perform those statutory functions that are being given to us. So some of those functional elements that within the system arguably aren't completely clear, and there's some room for improvement, let's just say, in terms of describing our functions in law, and having the appropriate safeguards to be transparent about those things to the public, which is really important, and ensuring that the other corporate risk is about making sure that the mechanisms are there. So when we are utilising data, either for a direct care or indirect care purposes, that that the public are fully aware of the circumstances, of the consequences of the use of that acquisition and then dissemination of that information. So it comes in two parts. Both of them are very reliant on our stakeholders and also government to actually support those mechanisms. We are working in tandem with government in order to ensure that both our functional and then our transparent elements are as robust as they can be. But it is incumbent on government helping to actually support that through directional use and ministerial responsibilities as well, to actually move that into the service in a way that there is no ambiguity. So there are some really important actions that are coming collaboratively either through our remit letter and through the work that we're doing around the national architecture and through other functions that DHCW hold, in order to recognise the cooperative element of working with government in order to get those corporate risks mitigated as far as they can be. But there is a lot of work to do in order to try and reduce those risks effectively.
Thank you, Darren, and thank you for clarifying that. And the last word on this to Laura Tolley.
Diolch, Marion. It's just to provide the committee with some assurance around this. So with the Digital Governance and Safety Committee, Alistair will be familiar, we did have a deep dive specifically on those actions at the last committee meeting, which looked at our timeline of mitigating actions that we're able to do as an organisation to try and address those risks. So that's all fed through the DG&S committee as part of the trend and analysis and the deep dives into that area as well. Diolch.
Diolch, Laura, that's very helpful, and that brings us to a close on this specific audit. A very positive outcome all round, robust information governance framework in place, and I think we can take a great comfort from the positivity around that audit. And our thanks to Stephen for completing this work, which will be very, very helpful indeed in terms of taking some of that learning forward. Diolch yn fawr. I'll ask you now then to introduce the second audit before us today, which is the staff culture and well-being. Diolch yn fawr, which was an advisory audit, of course, as opposed to the substantial assurance that we received for the previous. Diolch.
Thank you again, Chair. So as mentioned, this was an advisory review, and there's probably two fundamental differences to flag up. One is we do not assign assurance rating, but secondly, we have a bit more scope to expand the remit of the review and go into more detail and depth in some areas that may be more useful for the organisation. So it gives us much more creative freedom with the work that we do. And the advantage of this is that we can explore a number of areas and raise recommendations to aid the organisation. The flip side is, of course, that it often translates into a lot more recommendations, but it isn't necessarily an indication of more areas of weaknesses, but rather more value-added points to flag up. And to assist with categorization or prioritization of these recommendations, we've categorized them into a number of different sort of RAG ratings, if you will. So, the ones that are highlighted as red or escalate, they're the ones that should be focused on as a matter of priority over and above the other recommendations. So they may typically have been, if it was an assurance piece, something that's a higher priority or a strong medium finding. The strengthen and low priority, as described, are not as significant, but should still be reviewed and given due consideration as to whether they should be implemented. And indeed, the recommendations on the management considerations as a whole should be considered and assessed whether they should be implemented and the benefit to be obtained from that. That being said, we've tried to include points that we think would help the organisation considerably. Alongside that, for I guess a benchmark or a reference point, we've split the management considerations, matters arising, and elements of the review into different categories to try and group them together to provide a sense of, okay, this area is relatively good, or this area could do with some improvement. And they, in this instance, cover sort of leadership management, core values and beliefs, behaviours and norms, etc. So we've analysed and presented the information in a variety of perspectives to aid with implementing some of these considerations. And the review overall focused on employee satisfaction, engagement, and support mechanisms in place. And we found a lot of work underway as a result of a variety of matters from the last 12 months. But there's a lot of progress in place. There's a new operating model for people in OD function that's seeking to enhance organisational culture and embed wellbeing into strategic priorities. There are a number of positive initiatives, such as the Employee Assistance Programme, Wellbeing Champions, flexible working arrangements have been implemented and well received. But alongside that, we came across wellbeing plans that are in place, which is good. Some improvement around SMART objectives and prioritisation of some of those points would be beneficial. But we also found comprehensive organisational coverage as well. We've raised the point around the wellbeing initiatives often being reactive, with some limited evaluation of their effectiveness or cost-benefit impact. And we feel there's more of a need for proactive measures going forward. Some of these might include early stress detection or targeted support for neurodiversity. We also found that overall there is a strong commitment to staff wellbeing, but there were some gaps with data collection, engagement, and accountability. Whilst we saw pulse surveys taking place, there's an absence of more recent feedback mechanisms and surveys from staff, recognising that the staff survey is currently live across Wales. But overall, training and support is available. On occasion, it's constrained by budget available, and there could be some further support services implemented for staff as well. And whilst we did come across inconsistencies in documentation, such as misalignment between the behavioural framework and appraisal processes, overall, there is a lot of measures and initiatives in place to aid staff and support staff when they need it. But as I said, we have included a number of recommendations or management considerations for the organisation to consider. There are more than we would typically include, but we're hopeful that will provide some more direction and guidance as well for DHCW. But a bit of a snapshot of a very, very detailed report and review that was completed, but very happy to take any questions. Thank you.
Thank you, Stephen. Before I open it out, can I ask Sarah Brooks perhaps to respond to the findings of this audit, which is a very detailed and helpful one, which will clearly provide a lot of guidance to the organisation going forward. And it's been particularly pleasing to see the progress that's been made in fostering, a more inclusive and supportive working environment. So thank you for that, Stephen. Sarah, your response.
Diolch, Chair. I'm Sarah Brooks, Head of Culture and People Strategy. So I'd like to say thank you for your feedback and observations, Stephen, regarding our staff culture and wellbeing approach. We welcome your findings and recognise the importance of moving from reactive to proactive evidence-based wellbeing strategies. And we are actively progressing in several key areas. It's great to have some focused recommendations, and we can build this into existing work such as our culture roadmap. So we are proud to be certified to the British Standard 76,000 Valuing People and ISO 30415 Diversity Inclusion Standards, and the audit recommendations will support our approach to continuously improve. The Staff Culture and Wellbeing Audit Report here was presented to our executives last week by Samantha Morgan, our Director of People and OD, and well received. And to provide assurance to the committee, we've developed our culture roadmap, which highlights what we're going to do over the next 12 months and is currently being socialised in the organisation. Since this audit, we've undertaken a compassionate culture pulse survey, and we're currently analysing the results. And I would just like to say really thank you to the audit team, particularly Stephen and Christina, for their time, patience and engagement during the recent audit, and happy to answer any questions. Thank you, Chair.
Diolch, Sarah, and good to hear about the various initiatives that are being in train as a result of this. Claire Osmondson-Little.
Thank you, Chair. Diolch yn fawr. Thank you, Stephen. I think this one does give us quite a number of actions to take on board and embed into our current work practices. And I was part of the exec review last week. There are a couple of things that I do think we need to act on. So the first one is, in section 1, you do talk about the fact that we should be using more proactive measures in and around our workforce. I would really welcome support in understanding what those measures could look like and how we embed those into our business reviews with our business partners at a directorate level. So, Stephen, if I could reach out together with Sarah to understand what that could look like, I think that would be really helpful.
Of course.
And then in objective 4 and 2, section 13 and 14, the confidentiality aspects and the stress management. Those are two areas that as DHEW we have to get right. So I was a bit concerned around the escalation nature, and I did raise with the exec last week in and around, certainly on the confidentiality aspects, what weaknesses there were in relation to personal data being adequately protected and how we would action our improving and trust. So I would just ask Sarah in a moment if she'd like to comment on that. And the other one is around stress management. At a time where we're about to start our new staff survey, it's really important to us as a team that we work together to ensure, where possible, we identify and mitigate areas of stress. So I know that that's an area that the workforce team are working on. So again, Sarah, it might be worth you highlighting what are the specific actions around stress management that you as a team are working on. And then the final question, Sarah, is for me is how do you suggest the audit committee has visibility of the actions that we're going to take as a result of this report, and how frequently you suggest that we should review that as in this committee, because our workforce are our key asset at DHEW, and alongside Sam Morgan and the team, we are really keen that we address some of the observations that Steve and the team have identified as part of this report. Thank you, Chair.
Diolch, Claire, and certainly I was going to suggest that the audit committee commissions perhaps some further work from internal audit, as this was something we invited in internal audit to look at initially. I think there's some merit in actually revisiting this at a point in time, as perhaps we look to plan our internal audit programme for next year, perhaps. But I'd be interested to hear your thoughts on that, Sarah, and perhaps your response to the other 2 points that Claire has made.
Thank you, Chair. Yes, in response to Claire's points, one around the confidentiality of data. Yes, we are aware and looking into this. So this will be picked up within the team. So this will be addressed and picked up, and we can feed back on progress against that area. Stress management and specific actions about that, well, that will be picked up as part of our wellbeing action plan going forward in terms of being more proactive and looking at the measures. And I appreciate your question to Stephen about supporting us with identifying those proactive measures to support that too. And I suggest that we bring this back to audit committee on a perhaps a quarterly basis in terms of showing progress and update on where we've got to.
Diolch, Sarah. And I can see Laura would like to respond directly to that, I suspect. Laura?
Diolch, Marion. Yes, and I think we had this discussion around how we manage and monitor our progress against these actions. And whilst we don't normally include advisory report recommendations on our DHEW audit action log, we have agreed internally that we will do that for this report, given that it's such an important area of work. So the committee going forward will have oversight of the progress against all of these actions. And then what I suggest then is we can choose areas to deep dive, do in 10 seconds, and then we can bring those back then going forward for further assurance as we've done previously, if you're happy with that approach. Diolch yn fawr.
That sounds excellent, Laura. Thank you very much. Claire?
I think as part of the audit committee, it would be really helpful as part of the action plan to know the timetable and deadline set, particularly for those that were escalated, so that we really do have assurance around the targeting those particular areas in a timely manner. So I think that Laura, I don't know if that's going to create more work for you, but I do think as an audit, we've got our next one is in January. I do feel actually it would be good to see the action plan coming out from this audit to the committee, just to give us an assurance of how we schedule potentially some deep dives over the forthcoming year, then to ensure that we address some of the comments and actions that were raised.
Thank you, Claire. I think that's a very good suggestion, and we'll take that forward alongside looking on the at the internal audit plan for next year. Stephen, do you want to respond to Claire's question in terms of more proactive measures and, you know, her challenge to you in terms of welcoming support? Anything you'd like to add at this point?
Yes, nothing specific, but very happy to certainly get together and look at that and provide further information behind what we found. We have, as you would expect, quite a wealth of detailed information, but in terms of the proactive approach, certainly very happy to advise that. It's probably worth mentioning that this is a review that we're completing at other organisations as well, so there is an opportunity for learning to be shared there as well. However, I will say that the DHCW often features quite high up the table in terms of performance. So certainly, if there are learnings to be had, we will very happily share that. But we can provide feedback too on proactive measures. We've got quite a wealth of material behind the report as well, which is quite large. So.
Thank you, and good to hear that the learning from this report can be shared with other organisations as well. Diolch, Stephen. And a final comment or question from Marilyn Bryan-Jones. Marilyn.
Well, good morning, Marilyn Bryan-Jones, Independent Board Member. I just wanted to add on the proactive stance. I'm just thinking there's a real opportunity for us to actually get some feedback from staff themselves on what has possibly worked for them as well, because that links to the issue we've talked about, stress management. So it could be that there's really good areas of good practice where people have found it's useful and valuable. So it might be an opportunity for us to glean, to work in collaboration in this area. I think that there'd be value to that, because there could be lots of good methods that have been used individually as a result of this. And I think going forward, it would be a very positive way of looking at it as well, Stephen. You might have already done that, so I do apologise then. But, you know, I think there's a real opportunity for us to sort of embed it. And if we've done it already, just have it in place so it's something that we continually do as well. So, diolch. Thank you.
Diolch, Marilyn, your comments are well made. And finally, the last word on this then from Stephen.
Thank you. It's just a very quick point. It's very often about making the tools available for staff to be able to access easily at their own convenience. Their best place to seek out support. Often they would do it on their own. A number of organisations across Wales, they have those tools in place, whether it's something like the employee assistance programme, as I mentioned earlier, or being able to reach out on their own. There are a number of initiatives in use at other organisations that staff are able to do that. So that'll lend itself towards a more proactive approach. So rather than waiting until burnout, for example, has been reached by a staff member, they can take steps to address that earlier on within the process as well. So there certainly are a number of quite easy measures to address some of this as well.
Diolch yn fawr. So I'm going to bring this discussion to a close. So clearly a lot of progress has been made in what is a very important area for DHCW in terms of the culture and wellbeing space. There are 15 recommendations, as we've heard, so we shall look forward to an action plan being brought back to Audit Committee with clear timelines and targets for delivery. So hopefully that can be brought to us at our January meeting. And thank you, Stephen, again for your work on this, and thank you, Sarah, for responding so comprehensively. We are being asked then to receive the 2 audit reports for assurance, which we are happy to do so. Diolch yn fawr. I'm going to take us on now then to the next agenda item, and I will invite the Head of Performance Audit at Audit Wales, Nathan Cowt, who's going to present the Audit Wales update and the DHCW structured assessment for 2025. Nathan, croeso.
Thank you very much, Marion. Good morning, everyone. So I'll take the update paper first then. So this is the routine paper which provides the committee with an update on our accounts and performance audit work at DHCW. We also provide additional information on relevant examinations published by the Auditor General and relevant corporate documents published by Audit Wales. To start with the accounts audit update, it's a very brief update actually. We've now completed the audit of the 24-25 financial statements, and planning for the audit of the 25-26 financial statements will begin early next year. Moving on to the performance audit update. We completed the 2025 structured assessment and the reports in today's papers. A review of digital transformation at DHCW is underway, and we are planning to present the report at the next meeting of this committee in January. More broadly, we're making good progress delivering our digital transformation reviews across the other health body sites, and we're still on course to issue those draft reports prior to Christmas. Moving on, there's been a slight change to the focus of what we previously named phase 2 of our digital transformation review. This was initially set to focus on DHCW system leadership role in supporting the digital transformation agenda. However, this review will now be expanded to examine national arrangements and will therefore form part of our National Value for Money Work programme. This has therefore left a gap in DHCW's audit plan, and we have subsequently replaced the original review with a new local review examining DHCW's arrangements to support delivery of the 25-26 remit letter. The field work for which is currently underway. Finally, on our performance audit update then is our deep dive review on estates remains in the scoping stage. Lastly then, exhibits 3 and 4 provide information on other relevant publications with nothing new since the previous committee update. Happy to take any questions on that.
Diolch yn fawr, Nathan. Thank you for that update and the clarification around the change to the plan to include a review of the deliverables of the remit letter, which is a positive way forward. Did I see someone's hand up? Alistair, was that you? No. Okay. We're noting then.
Sorry, Chair. Andrew got his hand up. Sorry.
I'm sorry. I thought I saw a hand up popping somewhere. Andrew.
Yeah, it was morning. It's just really to highlight that our central team, who undertakes the National Fraud Initiative work, have provided us an update. Now, it wasn't in time for us to provide that paper to the committee. So what I suggest is that we provide that paper to you outside of the committee, and then if you have any comments, we can deal with that sort of and respond to those offline. The National Fraud Initiative is part of a data matching exercise, so it's not just undertaken in Wales, it's across the whole of public sector, and provides some value. It creates a lot of matches which then need to be followed through. So our colleagues centrally will be meeting with each of the counter fraud teams to identify the actions being taken to address that. So what I suggest is that if we can circulate that paper outside of the committee, and then in January provide a bit of an update on how things are going at that point.
Thank you, Andrew. Okay. Can we take that as an action then, Laura, to circulate that, and we'll take a more formal update at our January meeting? Diolch yn fawr. So we are receiving the Audit Wales update for assurance. And I shall now invite Nathan to take us through the structured assessment for 2025. Diolch, Nathan.
I'll briefly hand to Andrew, if you don't mind, Chair, because he'd like to introduce the report, and then I'll talk about the detailed findings.
Thanks, Nathan.
Yeah.
Yes, I'm sure you're sort of familiar with the structured assessment approach. We've been undertaking it for a number of years, but just briefly to go over it, it's an area of it's a governance review which is there to discharge our value for money assessment duties. In terms of the content, its focus is broadly the same year on year, focusing on board and committee effectiveness arrangements, systems of assurance. So those are things like risk management, performance management, quality, and also the organisation's ability to respond to ours and wider recommendations made by internal and so on. We focus a bit on strategy and planning arrangements and also financial performance management and control. The scope, as I say, is broadly similar year on year. There are some aspects where we focus a little bit more on in some years. So in some years we might focus, for example, a bit on well-being future generations or so on, but the core elements are the same. What I really wanted to do was highlight that the reporting style has changed. So it's something the committee might be aware of. I think this is probably in Wales the first NHS report that we prepared in our new reporting style. The aim of it is to be shorter, sharper, and crisper in the style of reporting, and that's to sort of try to improve accessibility, to reduce some of the technical language, which as auditors we like to normally include. So hopefully you'll see that there's a difference. Hopefully it'll be a positive difference. We'll be issuing other reports in this sort of format and style, not just here, but across the whole of Wales. And certainly we'd be welcome to receive feedback over the next 3 or 6 months on how you feel that's going. Thank you, sir. After that, I'll pass over to Nathan.
Thanks, And. Okay, so if I just quickly take the committee through the detailed audit findings from our structured assessment. And so in terms of board effectiveness and openness, we found that DHCW operates openly and transparently, and actively seeks to improve how its board and committees work. So within that, then we found that DHCW continues to demonstrate openness and transparency of board committee activities. Governance arrangements are clear, up to date, and reviewed annually, helping the board and committee run effectively. DHCW's board and committees work effectively. However, the programme delivery committee should focus on issues within the DHCW can control. DHCW continues to engage effectively with staff and service users, and DHCW has a stable board and demonstrates commitment to continuous improvement. In terms of providing board assurance, we found that DHCW has reasonably effective approaches to providing assurance to the board and committees on risks, performance and quality, but it could strengthen them further. So we found that DHCW has a strong strategic and corporate risk management arrangements. Performance management arrangements are improving. However, there is scope to improve information provided in the integrated organisational performance report. DHCW is committed to embedding quality across organisational systems and processes, but there are challenges in embedding the requirements of the Health and Social Care Quality and Engagement Act as a non-patient facing body. DHCW continues to have reasonable arrangements for monitoring and tracking audit recommendations. In terms of preparing strategies and plans, we found that DHCW has a clear long-term strategy and medium-term plan, but it needs to improve its arrangements for obtaining assurance on delivery outcomes and impact. So we found that DHCW's organisational strategy and IMTP sets up a clear vision, goals and key actions. However, while the key actions for year 1 in the IMTP are clear, details for years 2 and 3 in some instances aren't fully formed. DHCW will need to maintain progress and manage risks associated with this escalation action plan, particularly those risks associated with milestones requiring input from outside partners. DHCW is making progress with delivering its Building Our Futures programme, a new product-focused operating model. However, there are some risks to delivery that will need to be managed going forward. And DHCW's arrangements for overseeing the corporate strategy and plans are reasonably effective. However, there is scope to improve update papers to board. Finally, then, on the managing finances, DHCW manages its finances well, but there are still risks relating to short-term funding requiring ongoing management. So DHCW met its financial targets for 24-25 and is forecasting to break even for 25-26. DHCW's financial planning is strong and supports its strategic priorities. While the annual priorities fund offers DHCW more flexibility, it continues to be short-term, presenting difficulties to medium-term planning and hiring of staff on long-term contracts. DHCW has a good approach to finding savings and overachieved against this 24-25 recurring savings target. However, most savings still come from not filling vacant roles. The Finding More Value programme is identifying savings, but it's not yet clear exactly what those savings are, how much will actually be delivered, or what impact they will have on future finances. And DHCW continues to have a strong approach in financial oversight. So in summary then, overall, the DHCW continues to demonstrate effective governance, systems of assurance, strategic planning and financial management. However, there are some areas for improvement, including more focused oversight by the programme's delivery committee, clearer reporting on performance and strategy delivery. We made 4 recommendations that will strengthen the arrangements further, all of which have been agreed by responsible officers with appropriate timescales. And just finally, I'd just like to thank DHCW colleagues for their continued engagement with our work. Happy to take any questions on that.
Diolch, Nathan. That's a very clear summary of your key findings of what is clearly a very positive report. Very good to hear that DHCW has an effective board supported by good governance and a strong financial management processes. And as we've discussed several times over the past year or so, a very clear long-term plan. But there are clearly areas of improvement and a number of recommendations which you've highlighted. I wonder whether Chris would like to respond formally now on behalf of the board before I take questions and comments from independent members. Chris?
Diolch, Marion. I think the first thing to say is that I really like the new style template Andrew mentioned earlier. I think it is more user-friendly, easy to follow up front, so you can get a snapshot of what the audit's telling you. Also welcome the speed at which the structured assessment's being carried out. It's really helpful, I think, for us as a board to have it earlier in the year, so we can kind of consider the recommendations before the end of the financial year. I think the themes for me, reading through the report, it's a journey. Having worked for the organisation for 4 years, you can see how each year there's themes that we've either overcome or, I think, and this is one of the challenges, I think, for us, there's a few areas where we are struggling to address the fixed funding of post the sustainable funding challenge. I think are things that we know we're working on, but we require to do more in partnership. And there's a couple of other areas that I think we need to tighten up on, particularly tracking action plans relating to strategies that comes through the structured assessment. The other point is the external environment and our working with partners, and how we focus our time on things within our control and outside of our control. So I welcome the report. I think there's some really helpful findings. I know Laura's done some work on the opportunities for improvement she might comment on later. We always try and look for things over and above the formal recommendations to improve how we work, but welcome the findings, Marion.
Diolch yn fawr, Chris. Thank you. I'll open it out for questions then. Alistair.
Yes, thanks, Chair, and thanks for the report. Just to highlight also that it does come across as a positive report, which I'm pleased to see. And as the Chair has referenced, the governance and the financial controls are soundly reported on, which is, again, extremely important, but good to see. I think the recommendations are really helpful. They're clear and they can be acted on, and we can follow up on them, I'm sure. And you will, I'm sure, want to follow up on the actions that are taken against them. So I think that's very helpful. Reliance on not filling vacancies, as we all know, is something that really prevails right across the public sector. And it may well be that this is something we need to look at again, with the thought that if a vacancy has not been either filled or not been required to be filled for the span of reasons that are there, including saving on budget, if they've not been filled for more than 6 months, whether or not those vacancies should be deleted as vacancies, and that's certainly reviewed as such, rather than keeping vacancies open, just as a thought. And on the point about savings delivery and significant reliance upon that, I think, you know, where my head is on that is that we have a very good track record on delivering savings, and I know that puts pressure on Claire, Mark, and others, but we do have a very good track record on it. So I have confidence in the team being able to deliver, and that they would highlight if they were concerned that there were real problems in delivering against the savings that are projected. So overall, I think, you know, some very helpful comments in there. Thank you.
Thank you, Alistair, and I'm sure we'll be coming back to some of those themes later this morning in our audit committee in the finance paper, which references very clearly the shift from perhaps an over-dependency on post vacancies. But I'm sure that Claire would like to respond more formally to that now. Claire.
Yeah, thank you, Chair. Diolch, and thank you, Welsh Audit Officer Nathan, for the work that they've done on our structured assessment. So my reflections would be that the observations around the challenges that we have in being agile around our funding in the short, medium and long term comes across in the report, and we recognise that, and I think that's a system-wide issue as well as a DHEW issue, and particularly going into the forthcoming year with budget setting. I think it's going to be very short-term orientated again, which does bring its challenges around how we manage short-term resourcing requirements, which we alluded to there. So I'm sure Mark in his later presentation will help with that. And obviously we've got a strategic resourcing group that's working hard to balance that. The other comments I wanted to make really were around the performance report. And again, ISIS has joined the organisation, and collectively we are looking, as we move to a new service-led organisation, how do we orientate our performance report to really underpin that and give you assurance, greater assurance on delivery. So there's a lot in the report. There's a lot of great stuff, and thank you for that. And obviously we're working alongside Welsh Government to understand our funding requirements, and our Building the Future programme really try to address the longer term view as to what are the internal efficiencies we should aim for as a result of changing our technology layer, changing our organisational structure, and to improve our stakeholder engagement and satisfaction. So we would hope that as that becomes real over the next couple of months and years, that the conversation will shift away from the dependency on vacancies to more about the efficiencies we are driving at DHEW that enable us to work with less resources, and therefore deliver value for money for the NHS in Wales. So I welcome the report. It's really an important part of our assurance processes. So thank you for that. And alongside my team, I'll be working on addressing some of the observations that you've made. Thank you, Nathan and the team.
Thank you. Thanks, Claire.
Yeah, Claire, thank you for that. And Mark Cox.
Thank you, Chair, and thank you for the report. Excuse me. I think it was heartening, to be honest with you, and I welcome the report because it just supports the areas of focus within finance over the last 6 months, particularly in terms of a shift away from non-recurrent savings to recurrent savings. And you'll see from my presentation a bit later on, the savings planning is fundamentally non-pay driven for this financial year. We do also take on board the comments regarding the more longer term savings, and indeed we have done a few exercises in terms of ascertaining the degree of confidence within the directorates to deliver those savings over the next 5 years, and also refining the projection over the next 5 years. So it's really heartening to see our areas of focus that align to this report.
Thanks, Mark.
Diolch yn fawr, Mark. Thank you very much. If there aren't any other comments, I can see Paul's hand up. Paul, diolch.
Diolch. First of all, thanks for the report and the positive feedback on the annual quality report. So that was really pleasing to hear. Some of the other issues raised in the report, I'm hoping that the quality framework that this committee has just approved this morning will be the link that bridges the gap in some of those areas. So I'll be trying to roll that out at some pace over the next 3 to 6 months, and hopefully when we come to the next structured assessment, we'll have covered some of those gaps off.
Diolch, Paul. Thank you very much for that. And Laura.
Diolch, Marion. I'll just a brief comment, if I may, just to say, firstly, thank you to Nathan. It's been a pleasure, as always, to work with you on the structured assessment. And just for Chris mentioned, the approach we take to learning from the structured assessment is a really valuable tool that we use in DHCW. So we've identified 10 what we call positive practice areas, which we're working with leads to take forward. And that includes actions such as reflecting the Wellbeing of Future Generations Act in our terms of references for our committees, strengthening our committee highlight reports, and then developing our corporate risk register to demonstrate key controls and so on. So I am intending to bring that action plan to the next committee meeting so we can demonstrate our learning that we've taken from this report going forward. But diolch yn fawr iawn, I really appreciate the report. Thank you.
Diolch, Laura, and thank you for highlighting those 10 positive practices that you're going to take forward. And as a committee, we look forward to seeing the action plan with deliverables against it. Clearly, a lot of work has gone into this, and I'd echo Chris's comments as well, how helpful it is to have this so early or at the midpoint through this financial year, because I think that is very helpful for colleagues around this table. It's a very, very helpful document. And also, given that we're in escalation, your comments about the need for the Programme Delivery Committee to perhaps focus more strongly on areas within their control, I think is a helpful comment as well. And I'm sure the committee will be keen to take that forward. So thank you, Nathan, and the team for all your work on this. And thank you to DHC colleagues as well who've worked hard alongside you. So thank you, and we'll bring this part of the agenda then to a close. Diolch yn fawr unwaith eto, Nathan and Andrew and colleagues.
Thank you, Chair.
So we are receiving the structured assessment, a very helpful document for assurance. And we'll move on to the audit action log then. Can I please ask Laura Tolley to update the committee on the current status of the audit action log and please highlight any changes that have happened since our last committee. Diolch yn fawr.
Diolch yn fawr, Marion. Yeah, so a quick update from myself today. We've made good progress in the last quarter. We currently have 27 actions on the action log, of which 7 have been marked for complete. They're outlined in section 4.5 of the report, and we're requesting the committee to note the completion of those. The remaining 20 are on target, and I've got no concerns for those being met at the time of writing and during my engagement with leads across DHCW. There will be a number added to the report following the Culture Wellbeing Advisory Audit, so that'll be another 15 and any other ones that will come through. So we are expecting to have quite a bit of an increase over the next quarter, but I'll just continue to work with leads and get those updated. But that's all I wanted to highlight today, but happy to take any questions. Diolch yn fawr.
Diolch, Laura, and good to see that the actions are on track and you've no particular concerns in terms of progress. Unless there are any questions or comments then, I propose that we note the status of the audit tracker, and as you highlighted, we will see a significant increase in those actions as a result of the Wellbeing and Culture audit, which we've just discussed. Diolch yn fawr, Laura. Let's move on then to agenda 4.5 and the local counter fraud update report. And I'll now invite Henry Bales, Head of Counter Fraud at Cardiff and Vale Services, to present the progress report. Henry, croeso.
Thank you, Chair. I won't go through the report fully, just pick out a few points in there. So we continue to have very good engagement with the organisation in terms of awareness and completion of e-learning. There is a link there to a newsletter, which is the June newsletter. However, just where this fell, there is a new one. So if you go onto the SharePoint, you should see the new one. And Jake would very much like everyone to read that, as I would, so we can keep getting that awareness out there. In terms of the bulletins and intelligence we've had in this period, I just want to raise everyone's awareness about the AI, as we will all know, and how these scams are getting more and more sophisticated and better, and they are targeting people with CEO impersonation frauds, which seems to be a bit on the rise at the moment, either through emails or through WhatsApp messages. So just everyone remain vigilant in that area. And National Fraud Initiative, to pick up on the update from Audit Wales earlier, I've got my meeting with Nick tomorrow to discuss how we approach NFI and to give those updates to feed into the review they're doing there. And from a counter fraud perspective, we have cleared all of the NFI matters that we would look at, apart from the one which was raised to investigation, which is still ongoing, but everything else has been cleared from our perspective. And shared services continue to work through their matches in relation to the invoices that are going on. There have been 7 referrals, which in terms of the numbers is a pleasing, how you take it, but a pleasing number to show the engagement with the organisation that we are getting those reports to come through. We've closed one investigation in the period with no fraud identified. However, we've then opened up another one, which is still ongoing with ourselves, and there remains one investigation that's been undertaken by Counter Fraud Service Wales. And pleasingly, there's been no significant salary overpayments in this period that meet the £5,000 and 3-month threshold for this period. So happy to take any questions on the paper.
Diolch yn fawr, Henry. Thank you. Are there any questions or observations to the counter fraud update? Don't think that probably reflects the clarity of your report. And as you say, 7 referrals, which can be viewed as a positive, that there is a willingness to engage with this agenda, and that's very important indeed. So if there aren't any further comments, can I thank you, Henry? You're free to leave the committee, but I know you'll be joining us for the private session later this morning, and look forward to seeing you there. Diolch yn fawr. So that brings us nicely then to the end of this part of the committee's agenda. I'm now going to start the break. We've just a couple of minutes ahead of schedule, but I propose that we reconvene at 10 minutes to 11. So you can kill your cameras, and we'll see you back in 12 minutes. Diolch yn fawr. Croeso nôl gyfeillion I ail hanner y pwyllgor archwilio. Welcome back, everyone, and I'll now take us through part 5 of today's agenda, which include a series of governance reports. It is 7 months now since DHCW was elevated from level 1 to level 3 monitoring. So I'm now going to invite Chris Darling to present DHCW's approach to its escalation status and improvement plan monitoring. So we as an audit committee are able to take assurance that it is being monitored appropriately. So over to you, Chris. Diolch.
Diolch, Marion. Yeah, so this item was requested, I think, at the last audit committee to really focus on the approach that we've taken to escalation, and consider if there's anything further we can do as we continue on the journey responding to our current escalation status, which, just for the record, as you say, is into level 3 relating to major digital program delivery. So in March, the escalation triggered a number of actions, some of which responds directly to the escalation framework issued by Welsh Government. Others are based on wider learnings, which I'm just going to run through because I think they all form part of our response. And I'm just going to break those down into a number of areas I'll talk to. So the first one will just be about the response we've taken to the escalation framework. Then we're going to just look at the approach we've taken as a DHCW board, the approach we've taken to staff, and a few other additional considerations. So in terms of the escalation framework, Welsh Government, as set out in the overarching framework, will pull together an escalation framework for the individual NHS body within 6 weeks, or they target doing it within 6 weeks, to give clarity on the framework for that individual organisation's escalation. So we were escalated in mid-March. We had our framework come through from Welsh Government mid-April. I will say it was a very much a co-produced framework. So government colleagues produced the framework. They asked for feedback. There was a bit of iteration, not a vast amount. There was a bit of iteration, and then we formally approved and agreed that framework within which we would work to. So that framework provides the expectations, both from a DHCW perspective and from a Welsh Government perspective, to consider going forward. So a couple of things that framework confirmed, which has shaped our approach. Firstly, that performance management arrangements relating to escalation would go through the integrated quality performance delivery meeting with Welsh Government. So that would meet on a monthly basis to review performance against escalation, and that the joint executive team meetings with Welsh Government would include a section on escalation. So to date, we've had monthly meetings since April on IQPD, and we've included half the agenda. Section A of the agenda has been solely focused to escalation. That's been generally an update on the improvement plan, milestones, and then a deep dive into a number of areas that we've agreed with Welsh Government. We also had a JET meeting, a joint executive team meeting in June. That also included a section on escalation where we ran through the approach we'd taken. Between that, I've been having regular touchpoint discussions with colleagues in government and the escalation team. They've been more informal, but helpful nonetheless in terms of talking through where we've got to, some of the challenges, etc. A few other things that the escalation framework sets out. So it confirms roles and responsibilities. I'm just going to pull out a couple. So from a Welsh Government perspective, it specifically identified that a specialist digital advisor would be appointed, that they would attend IQPD meetings and DDAT leadership board meetings, and that the DDAT national governance arrangements, so the data, digital and technology national governance arrangements would be introduced, and that DHCW should use those arrangements as part of the response to escalation. So it's explicit that we should use those new governance arrangements. And I should point out, just in the context of the specialist digital advisor, that there has been a gap in the CDO, the Chief Digital Officer role within government. So that executive level appointment in government around the exec team table hasn't been in place. So to an extent, that specialist advisor has, I guess, to an extent filled some of that role. In terms of the responsibilities for DHCW, the framework confirmed that an SRO should be appointed. So that was myself appointed early on in the process. That board oversight throughout the process should be in place. The board should be aware of the escalation, why we've been escalated, and put in place governance arrangements to monitor escalation. The framework sets out that an improvement plan should be developed, should be approved by Welsh Government, and that should then be the basis by which monitoring improvement. So I'll just move on to talk a little bit about the Enhanced Monitoring Improvement Plan in response to escalation. So we developed that, and that was developed based on the criteria that was set out for our escalation. So the escalation framework was quite explicit around the programmes that we'd been escalated for, or the programmes that Welsh Government wanted additional oversight of during the escalation period. So the improvement plan has milestones set against a number of programmes. So the National Target Architecture, the NHS Wales app, Connecting Care, the National Data Resource Programme, the 2 diagnostics programmes, GP migration, digital medicines, intensive care, and the cancer informatics programme. So a whole suite of our major digital programmes were included as part of that improvement plan. We also included the de-escalation criteria within our improvement plan. So that included areas relating to programme management, programme delivery. It also included very explicitly our stakeholder engagement independent survey that we undertook and the action plan against which we developed following the outcome of that work. So the improvement plan, there's 42 milestones set out within it, and we've been tracking delivery of those milestones. Some of the milestones are very much programme milestones designed to show delivery against those key programmes mentioned. Some of them are more around how the system operates from a programme delivery perspective and looking at whether there's improvements that could be made at a system level to improve the way programme delivery takes place. The monitoring of that improvement plan, we've worked with Welsh Government to develop a shared Teams channel. So the monitoring takes place with support from the performance team. We have a shared area where we put in milestone evidence, we RAG rate milestones. Then for each milestone, we take through the programme delivery committee an assessment, a DHCW assessment of where we've got to. We do that before we go to the IQPD Welsh Government meetings so that we can say we've got a kind of committee endorsed position from a milestone delivery perspective. So that's the approach we've taken to the plan. And then just to mention the approach we've taken as a board, because I think it's probably fair to say, Chair, that we've seen escalation as an opportunity from a board perspective. I think it shines a light on an area that is difficult, it's challenging because of the number of stakeholders and the external environment within which delivery is predicated on. So we held 2 board briefing sessions in March and April very early on after being escalated. These considered the implications of escalation as a board. It also looked at our risk appetite and reopened a discussion around our risk appetite having been recently escalated. We followed that then in May with a independently facilitated board development session. That created some space and some time for board members to consider if there's anything we could have done differently as a board which might have prevented escalation. So some of that reflection time has been helpful. Since then, we've used the Programmes Delivery Committee as mentioned. We've assigned that committee as the subcommittee of the board to oversee the escalation improvement plan. The frequency of that committee has increased, so it's gone from quarterly 3 monthly meetings to 6 weekly meetings. The last meeting in September, we had the head of performance and escalation from Welsh Government attend to observe that committee meeting. Just to feedback in terms of the facilitated board discussion in May, I think there are a few things from an escalation perspective that we identified that in addition to coming out of escalation, I guess, as an output of this process, there were some additional opportunities that we identified. One was increased NHS Wales system knowledge and understanding of digital programme delivery. So not just within DHCW, but amongst partners, better clarity of roles and responsibilities across NHS Wales, improved national governance through the DDAC governance framework, and of course, improved relationships with partner organisations to aid programme delivery. We have had some additional expertise, independent resource commission through DHCW. That's been helpful in providing some additional challenge and learning through this process. And we've included feedback from Welsh Government at each of our board and committee meetings. So just briefly to touch on our approach to staff throughout escalation. So we've had a number of sessions. When we first went into escalation, we wrote, or the chair and chief executive of DHCW wrote to all staff to explain that we had gone into escalation, what it related to, and as much as we knew at that point in time. Myself and the chief executive held an all staff virtual Q&A session a couple of weeks after going into escalation to answer staff questions and answers. There were about 400 staff that joined that. It was very interactive. So we're able to kind of help staff understand the implications, what it meant. And some of the questions, I guess, did relate to, will it impact me individually? So we're able to have a good chat about that. We've had 2 quarterly leadership days where escalation has been on the agenda. We've had input from the quarterly leadership day in May into our escalation improvement plan. And we've also had regular updates from the chief exec at our staff briefings that happen on a 6-weekly basis. So just to summarise, those are the kind of areas and the actions we've taken in response to escalation. The one thing I think I would mention, I think we've been conscious as an organisation, as a board, that major programmes accounts for about 20% of the investment into DHCW. So we've tried to take a proportionate approach to making sure there's additional scrutiny and oversight of escalation in the area of escalation, but not lose sight of all the other areas of activity that go on within DHCW. And I would welcome any thoughts, feedback in terms of how we can strengthen the approach to escalation going forward. We're still in escalation now, noting that the approach we're trying to take is to build trust and confidence in us in delivering major programmes, and also the need to change perception around delivery and pace of delivery. Diolch yn fawr. Happy to take questions, Marion.
Diolch, Chris. That's a very comprehensive and clear update on a whole range of activities that you are undergoing, the board is undergoing, and it's very, very helpful to hear about the breadth of our response. I shall open it out to questions and turn to Alistair Neil.
Thank you, Chair, and thanks, Chris. Very thorough, and there's a lot in there that is, I think, really reassuring as an independent member to see just how we are approaching this, and it has my full support. I think it's a robust plan. I also very much appreciate the approach that you're taking, which is always to be looking for other ways in which we can strengthen it. So I think that's all very good. I think one of the things that is a feature of what is happening, and I think which is a very helpful thing, is that the co-production, the cooperative approach of working closely with the Welsh Government, they are obviously looking not only at confidence in the actions and in our plan, but also confidence in the team to deliver that plan. And that really is the essence of building a strong relationship. And I just wonder really if looking at escalation not as and moving out of escalation not as an end point, but a staging point, whether we can use that developing relationship to create something which is beneficial all round Welsh Government and DHCW, to develop it further and to develop beyond the point when we move beyond escalation. Such that there is an enhanced understanding by the Welsh Government of system priorities, of an all-Wales strategy that we strongly believe in, and our role in all of that, and indeed the Welsh Government role in all of that, and whether or not we could actually, as I say, look at this not as leading to an end point, but a staging point that we could develop something really positive beyond. I just wondered Chris's thoughts on that.
Chris.
Thanks, Alistair. Yeah, I agree. I think it has to be the basis of which how we work going forward. And I think one thing that we could do more of, that I think we're keen organisation needs to do more of, which I think would build on the points you've made, Alistair, is to have some more in-depth OD work with the Welsh Government teams and functions, perhaps some shadowing opportunities, because it's really hard, isn't it, to understand the pressures other organisations, functions are under unless you've seen it and felt it. And I've had some conversations with government about that. I think they are keen, but as I mentioned, they have had gaps in their functions, which has made it more difficult, I think, to build some of the relationships. The deputy director in post at the moment is due to retire in the next month as well. So there's going to be a bit more in terms of flux in that area, but I absolutely agree with your points. And I think all we can do to enhance those relationships can only help us moving forward. And I think we have to see this as a way that we work going forward as well.
Thank you, Chris, and thank you, Alistair, for those constructive observations. Claire.
So I would echo that. First of all, I'd like to say that Chris has done a very comprehensive plan, and we've integrated the milestones into our overall DHEW plan, and we really then focus on the staff and on delivery of those milestones, and that's really helped us integrate the escalations into our plans. I think we'd all like to come out of this stronger as an organisation, but actually stronger as a system. And I think as part of the IQPDs, they have been quite challenging. But actually, I think there's learning on everyone's side as how do we work as a system to deliver digital and make digital a force for good in health and care. I think there is a greater understanding of each other's roles as part of that. And actually, as part of one of the milestones, we are trying to reflect on how do we do this more effectively, more efficiently. And some of the work that Julie Francis is doing on the commercial frameworks to really understand from a programme perspective, how do we deliver digital programmes better and more effective in Wales, and what is our role and others' roles in that process. So I would say that none of us likes being in detention or in escalation, whatever you want to call it. It does create additional reporting requirements, as you can see from Chris's comprehensive report, but actually coming out of that, we need to learn from that and have a far more efficient and effective way of delivering programmes. And I think through some of the challenges, fair challenges that we're having through the IQPT is helping us facilitate, okay, just that, Alistair, when we come out of this, and we will, a stronger organisation and a stronger system, what are the key ingredients that we would like to see across the system to help us do that in a far more effective way? And through the audit committee, hopefully you'll see all of those come to the fore as we move through some of those 42 milestones that Chris has mentioned. Thanks, Chair.
Diolch yn fawr, Claire. Thank you. So as you've alluded to, a huge amount of work. Can I just pick on a couple of things, if I may, Chris? You referenced the Welsh Government external special digital expertise that's been provided to us. DHCW as a board as well have commissioned external expertise to support this process. Could you tell me what impact that's having and how helpful that is being to this journey out of escalation?
Yeah, thanks, Marion. I think the technical expertise or specialist advisor within Welsh Government has brought in additional technical insight and knowledge. And I think we've felt that in particular through the meetings we've had with government in the IQPD sessions. I think Claire would probably agree. There's been a lot of constructive challenge, and I would suggest that's probably in a way that we haven't had previously. Mm-hmm. I welcome that. I think it means that we have to be clear on what we're doing from an escalation milestone perspective and a response to some of those milestones. So I think it's just brought greater insight into how digital works across a system. And challenging us and others, I would say. I don't think the challenge is solely on DHCW. I think it's across the system and other partner organisations. So that's where I think we've seen some benefit. And I think relationship-wise there, Helen has regular meetings with that advisor now. So I think that's helpful in terms of forging some of those relationships. I think the the independent resource that we've commissioned internally, I think that's giving us an element of objectivity. So challenging some of our work, some of our assumptions in response to escalation. I think it's also allowed us to look through a lens of what's happening elsewhere internationally from a digital health perspective. Sometimes we do the work, we think we're on the right track, but having an independent view of it can be really helpful. So I think that's where that's added value for us internally.
Thank you very much, Chris, for that response, and thank you for all the work that you're leading on in this space. As you say, it's a small part of, a relatively small part, percentage-wise, of DHCW's activity, but clearly a lot of focus and resource being devoted to this area. So I'd just like to reiterate my thanks as well on behalf of the Audit Committee to all the work that's being undertaken in this area. So thank you again, and we are being asked to note the report for assurance. Diolch yn fawr. So let's move on to agenda item 5.2, which is DHCW's response to a series of Welsh Government requirements. And it's my pleasure now to invite ISIS Hurst, who's Head of Organisational Performance, to present this report and our response to the Welsh Government requirements. And we'll be hearing from ISIS on how performance against these is being monitored and reported. Croeso mawr, ISIS. Welcome.
Thank you. Let me just bring up the slides so I can share with you. Okay. As a special health authority, we have a responsibility to build and design digital services for health and care. And as such, there are many routes in which we're asked to deliver on our strategic objectives or support delivery across Wales, as well as doing our business as usual for our products that we support and deliver. This means that our priorities quite often change throughout the year, and indeed through parliamentary sessions, which can cause potential conflict and change. It's not an easy task bringing all this information together. So what we have done is pull this information, as you can see, and provide the information on what the different areas are. So this is all Welsh Government. They can come in at any time of the year, and we have an expectation to be able to respond to these. This includes many teams within the organisation who have that responsibility to report and deliver against any of the items or recommendations that are in each of the reports or letters. So as an organisation, we have pulled this together. And if I move on to the second slide, you'll get a better feel for what is actually contained in some of these documents. Some of them we have the opportunity for ourselves to provide the input, such as our IMTP, but others are given to us. And others that we actually support. So for instance, winter planning, we as an organisation were asked to provide information on how we can support our partner organisations across Wales in preparing for winter and supporting patients across Wales. Whereas also we have our own accountability conditions as an organisation, and obviously the escalation items that Chris has just gone through. What we've highlighted here is where we are sharing the information on our performance internally through some of our boards, and particularly our management boards, but also our external oversight as well through IQPD and JETS, and I believe through accountability meetings that will be taken going forward. So what I just wanted to do was just give you a taster that there's a lot of information that we have to pull together. We're keeping a track of it to ensure that we are providing a timely response to Welsh Government and to our executive team as well, where required. So any questions? Thank you.
Thank you. Thank you very much. That's been extremely helpful. It's almost a plan on 2 pages, as it were. And I found it very, very informative, just to bring the clarity of all those different strands together in one place. So thank you for providing us that assurance. Can I just check whether there are any questions or observations on what you've just seen and heard? Chris.
Yeah, Marion. Yeah, it builds on what you've said. Really, it's just to highlight, I guess, the complexity and keeping track of everything that is a priority at a time when there's a lot of priorities and the system, is under extreme pressure. So I just welcome the approach ISIS and the team have taken here, because I think having it on not quite a page, because I don't think it's possible to get it to fit on a page, but to have it in a way that you can have a quick oversight is really helpful for us.
Yeah.
Thank you.
Thank you very much. And I think the clarity of your report underlines the fact that you've probably answered all our questions in your presentation, and the report certainly, which is being brought to us for assurance, certainly does that. So thank you, Isis.
Thank you very much.
We move on then to agenda item 5.3, and this is a verbal update on the Digital Data and Technology National Governance. And I'd like to invite Chris Darling then to present this update, which we're being asked to note for assurance. Chris.
Yeah, Marion. Yeah, and there isn't a paper and I'll explain why as I go through, but this is the digital governance structure that I referenced in the escalation update links into this. So between June 2024 and October last year, Welsh Government commissioned a DDAT, so a Digital Data and Technology NHS Wales System Governance Review that took place during that time period. The findings were published in December 2024. And the findings were about trying to improve the system-wide governance arrangements relating to digital. So just to recap on the terms of reference for that group, it was around confirming a baseline position of governance across the systems, ensuring the system was clear on roles and responsibilities, accountabilities, mapping the governance bodies and groups, considering the risks and challenges, and then making some recommendations to address where there were perceived issues or areas that could be improved. So just to confirm, Welsh Government, and it's a Welsh Government review, so just to emphasise that, there were 16 recommendations coming out of that work that sat with Welsh Government to take forward and address. One of the big ones, I think, is the establishment of the DDAT Leadership Board chaired by either the Minister or the Director General / NHS Wales Chief Executive. And progress has been made there. So the inaugural meeting met in May this year, and that was chaired by the Minister. Since then, the Director General has chaired the meetings. There's been 3 subsequent meetings, and there's one in November. The paper I was hoping to present today was this substructure, so that there was clarity for the Audit Committee where the DDAT governance structure had got to and the arrangements in place. It's the reason there isn't a paper is because that substructure is still being worked through. So the DDAT Leadership Board has met a number of times. The substructure is not yet in place and it's still being consulted on. So there's a number of advisory groups, there's a number of boards that's proposed through that structure, but it hasn't been confirmed, and it's with government colleagues to confirm and take forward. Some of the other recommendations related to capability within the government digital policy team. So there's a number of recommendations that they're taking forward to address some of those areas. But I'm happy, Chair, to bring back, once that governance structure has been agreed and is being implemented, I'm happy to bring that back to talk through, because I do think from a DHCW national perspective, it will be very important for us moving forward.
Thank you, Chris. That's very helpful by way of explanation, and I agree that substructure is crucial, for our understanding. So once the DDAT board has completed its consultation and finalised that substructure, we'd be very happy to receive it in January at our next meeting. Thank you. Unless there are any questions, then we're noting that brief update from Chris, and we'll move on then to, where are we? Just lost my place for a moment. Here we are.
It's finance.
It's finance, absolutely. How could I forget? And that takes us to agenda item 5.4, which is the finance as well as the procurement update. So I'll now invite Claire to present that update, and perhaps you would introduce the presenters in turn as you see fit. Thank you.
Thank you, Chair. Diolch yn fawr iawn. We thought it would be really helpful at this point to give a bit of granularity on the finance position. As you know, NHS Wales at the end of month 5 was 125 million overspent and is forecasting an outturn of 191 million, with only 2 health boards actually reporting a balanced position at that point. So from a DHEW perspective, like all trusts and SHA, we are forecasting a balanced position for this financial year. But I thought it was important that we raise some of the planning and framework issues that we might have, the opportunities that present themselves, and also to echo some of the discussions we've had around our savings plan. So we now are entering our planning process, ready for next financial year. I know we're only just hitting the half year, but we're at that point again. I think it's also important to note that we are seeing risks around digital inflation. Digital inflation is running at a much higher rate than the underlying inflation. So again, collectively with directors of digital and with directors of finance, it's just raising that awareness as we go into next year. So I'm going to hand over to Mark Cox, who will give you, thank you, Mark, a couple of highlights in terms of how we're performing, our savings, and some of the work we're doing around our SLA structures. Thank you, Mark.
Thank you, Claire. And if I may, I'd like to briefly run through a few of the highlights via some slides which are attached to the papers for today. As Claire mentioned, a lot of the detail in terms of the financial performance is presented at SHA board. We are forecasting achievements of all our statutory targets for this financial year, but we'd just like to pick up and highlight some of the key areas and some of the key activities that the finance team are undertaking this for the remainder of this financial year. And particularly to just reflect on some of the structured assessment recommendations and comments. So we'll start off with the savings performance for this year and the identified savings going forward. The key focus for this year has been on the recurrent savings and the shift away from pay underspend towards a more granular level and a long-term view in terms of non-pay savings. We've managed to achieve over 90% worth of the savings target for this year, being recurrent non-pay savings, with the remainder being pay savings. So as part of the IMTP and the financial plan, 1.6 million was delegated to directorates in order to agree the savings plan going forward. This required management action, and we monitor this on a monthly basis, and we meet with the directorates to identify further opportunities as the year progresses. This slide just reflects the savings performance per directorate so far. In terms of the organisational position, we are forecasting overachievements of our savings plan for this year to the tune of 200k. There are some marginal variances across the directorates, as you can see. Some of the key themes in terms of the gains for this year were currently across operations, the great work that's been undertaken by the FinOps team to optimise the costs in relation to the DevOps tenancy and a DevOps Azure cost requirements has been fantastic this year, and we've identified 250K's worth of savings allied to substantial licensing arrangement savings within operations, which has contributed to a significant proportion of the savings of 800K for this financial year. So fundamentally, we're on target for this financial year. There's a high degree of confidence of achievement, and we'll be looking to build upon that as the year progresses. In terms of the longer term view, and this was articulated within the structured assessment regarding clarity of the approach going forward, and this has particularly been an area of focus over the last 4 or 5 months via the Building Our Futures programme. And we've identified opportunities as part of the shift to cloud, the integration hub piece of work, and that's surrounding bringing the integration work from a third-party supplier in-house. Considerable savings as part of the single patient record roadmap. The IT service management toolkit and efficiencies that will be generated as part of the implementation of that solution. The target model within primary care, and that requires spend shifts away from expensive third-party work packages into the establishment, and the great work that's happened within the corporate governance team regarding the rationalisation of estates. So in terms of the longer term profile and efficiencies and savings generations identified, we've quantified those particular schemes. We've engaged with the key leads in terms of degrees of confidence, and we've identified over 90% of those schemes have a moderate to high degree of confidence of delivery. The remainder requires a bit of complex management intervention, and we're looking to support that as we progress over the next 3 to 5 years. In terms of the pipeline opportunities, we'll be looking to benchmark the efficiencies and productivity gains generated as a consequence of the shift to the new target operating model and the agile and product way of working. It's a considerable task in terms of benchmarking those opportunities, but it's a piece of work we consider to be very important in terms of quantifying the success of the Building Our Future programme. Following on from that, as Claire mentioned, as part of our sustainable funding exercises going forward, we are looking to rebaseline the SLA charges for our services, and we'll be looking to make those a bit more transparent, clearer, aligned to our service delivery models. And the service delivery models have, of course, changed over the last 5 to 10 years. However, we are currently stuck with a legacy arrangement in terms of SLAs, and we're working with our operations teams and our primary care teams to identify the main cost drivers and appropriate cost recharge models, and we are also engaging at the same time with directors of digital and user organizations to manage expectations and get their thoughts on in terms of what a good model will look like in the future. So in terms of the key messages, as part of our grip and control, the mid-year review is ongoing. So we'll be looking to fix our core and programme financial position for this year in order to articulate the forecast position and indeed give some flexibility around the portfolio to reprioritise and repurpose funding into cost pressured areas to make sure we meet our deliverables for this financial year. The forecast financial position will depend on a number of variables we've identified, particularly around the recruitment cadence and the progress of the organisational change. Currently, in terms of the recruitment into vacant positions, 80% is identified as being internal transfers. So there's considerable impact in terms of the financial cost profile in which we're monitoring and managing. We do have opportunities in relation to capital funding, and we've made a bid to Welsh Government to retrieve further capital funding to support our delivery of our IMTP objectives, and also investor save and risk mitigation schemes. In relation to the Microsoft VAT recovery, we continue to recover the VAT. However, we received a protective order from HMRC dated the 31st of July, and effectively what that does is preclude us from releasing the VAT to NHS organisations at this time. It must be noted, this is not a formal decision from HMRC, and we continue to engage with our VAT expert advisors, Ernst & Young, Welsh Government and also HMRC in order to resolve the issue. We do keep our partners across NHS Wales fully briefed on the progress for this major and material opportunity that we are exploring. Last is the plan for this financial year, in particular the delivery of the financial plan as part of the IMTP. Generally, we get a planning framework which is submitted to all NHS organisations, and that articulates the assumptions for financial planning and the timetable. We are anticipating we're going to get that shortly, and upon receipt we will, as normal, present our timelines and our route to the IMTP and the planning deliverables.
Thank you, Mark.
Any questions?
So thank you, Chair. I don't know whether we pause there before Mark goes on to the high value procurement. Absolutely. And the losses and special payments.
Yes, so thank you very much, Mark, for that update report. It's very pleasing to note the forecast end of year position as a break even, and particularly in the light of observations made in the structured assessment that we considered earlier. I think it's particularly pleasing to see that 90% of the savings will be recurrent non-pay savings, and also that there is an overachievement on our savings plan. So that is very, very pleasing indeed. Can I check whether there are any questions or observations to either Mark or Claire? Thank you. I can't see any hands up.
Nope.
No.
So
okay.
I think Nathan, as you're on the call, you could see that, hopefully you could see that there's some medium and longer term financial strategic stuff that we're doing, that, you know, through the integration layer, through the cloud transition, which actually will give us an underlying recurrent savings level that is non-vacancy. That would be great, wouldn't it? But that's part of our building our future, and obviously that's part of, we will now build those assumptions now into our forward plan. But I think it's also important to note, Chair, that we are going into a short-term budgeting planning arrangements. We don't expect that we'll have an annual plan again this year in terms of the funding arrangement, and obviously we are having to make some assumptions around what that would mean for, particularly in our programme area, is where, you know, we need to have some dialogue with Welsh Government to understand what our planning assumptions are, and we've started that process. So obviously between now and the next audit committee, there'll be a lot of activity in that area to bottom that one out. So I will move us on then, and Mark is with us again to talk about the high value purchases, and also to give us a verbal update on any losses or special payments. Mark.
Thank you.
Thank you, Claire. And in terms of the high value orders position, obviously this is a recurrent submission to the audit committee in terms of briefing the audit committee and providing updates of high value orders over the threshold of 750k. For transparency, we also include cumulative orders that cross that threshold. In terms of the high value orders up to month 6, the total is 39.6 million, with 4.4 since the last audit committee. I just want to pick out a few of those orders, if I may. The EMIS order reflects the quarterly payments for service support for GP surgery support and maintenance, and that's for the Optum system. There's also an identified order for the vaccinating programme, text messaging and postage as the main items there. Just reflecting on the KNOS order, and that's reflective of the development work regarding the prescription functionality within the NHS app, and the piece of work regarding the waiting list referrals and the hospital appointment feature for that particular application. As part of the cumulative identified orders, I just want to bring your attention the work around the integration hub as part of the KNOS work, and that's part of the key spender saves we identified within the financial update, and that what we're hoping is that at the end of next financial year we'll start to recover significant gains in terms of the shift from the third-party supplier to the in-house provision of that service. So those are the key headlines in terms of the high value orders, Chair.
Thank you very much. I can't see any hands up, so I think we are happy to note that report. And over to you then to continue with this agenda item.
Thank you, Chair. And obviously there's no special payments or losses again to report. So I'd like to hand over now to Julie Francis, our Head of Commercial, to talk through any schemes of delegations to note for the committee. So Julie, over to you. Thank you.
Thank you, Claire. Bore da pawb. For today, there's only a handful of quotations and single tenders to note. One quote to the value of £20,000 and two single tenders to the value of £247,000. All of those are for the support of internal services and professional accreditations. One contract extension to report and note, which is outside the terms of the work package that was called off, and that was to the value of £13,418 for consultancy support to help the commercial and contractual activity in relation to the Sejdim buyout process, which is a very long and arduous journey and which we are now coming out of, thankfully. Thank you. There are no risks to report to the committee, and all activity has been in accordance with existing procurement law and standing financial instructions. Thank you.
Thank you, Julie, and thank you, Marion. That concludes our finance and procurement reports.
Thank you very much. Diolch yn fawr I chi tri. Thank you all three for your presentations. I'll open it out for questions, and Alistair first.
Thank you, Chair. And just to the last one, Julie, thank you very much for the presentations. There's nothing that I have that's troubling about it, just for clarification, if I may. The consultation expenditure, is that now complete, or is that part of what will be a larger consultation cost? And the other items that you've highlighted, are they part of planned expenditure, or is there anything exceptional of their nature, Julie? That would be very helpful to know. Thank you.
Okay, so picking up on the consultation, I'm assuming you're referring to the consultancy there. Yeah.
Yep.
Yep. Cool. So with regards to that, that's the end of the expenditure in relation to the consultancy to support us exiting away from Sejdim. In relation to your queries around were the other elements planned expenditure, they were, given that they are relating to existing services. The one I think maybe I'd like to point out is the fact that we saw that there was a need to change the support in relation to the consultancy around the GP reporting needs, given the Audit Plus position, but all were in accordance with a planned approach.
Thank you. That's really helpful.
Thank you.
Great. Thank you, Julie, for responding to Alistair's question.
Okay.
I can't see any other hands up, so I think that brings us to the end of this agenda item. So thank you, Claire and colleagues, once again for the reports on finance and procurement, which we are being asked to note for assurance, which I'm sure we are happy to do so. Diolch yn fawr. We'll move on then to agenda item 5.5. Committee members will be aware that we undertake a deep dive as part of our board assurance framework reporting at each meeting. And for today's meeting, we're looking at the duty of quality. Therefore, I will now invite Paul Evans, Head of Quality Assurance and Regulatory Compliance, to present this item. Paul.
Diolch, Chair. So this deep dive report is a key action for monitoring as part of our board assurance framework. And if it's okay, I put a few slides together to draw out the key areas to highlight from the report in the papers. So I'll just share my screen.
Thank you. Yes, we've got that.
Lovely, thank you. So, as committee members will be aware, DHW operates under the statutory duty of quality that's mandated through the Health and Social Care Quality and Engagement Act. And the legislation requires all organisations across NHS Wales to actively and continuously improve the quality of services. So, at DHW, we've embedded quality processes into routine operations to ensure strategic decisions are evaluated through quality impact assessments. There is a new iteration of the QIA document that we'll be testing this month, which we've simplified somewhat based on feedback. But these assessments are designed to help identify and mitigate potential impacts on the quality of our products and services. You see from the slide as well that WIAG, the Wales Informatics Assurance Group, is mentioned, and WIAG does play a critical role in overseeing the delivery of safe, timely and effective digital solutions. And as we noted in the structured assessment earlier, our annual quality report in 2025 provides a comprehensive summary of quality-related activity across all directorates in the organisation, supported by data from the quality team. And I think that report reflects the organisation's commitment to excellence and continuous improvement, and it showcases our alignment with our international standards, such as ISO 9001 for quality management and 27001 for information security, but also British Standard 76000 for valuing people, putting us in the position we want to be in as a people-centred organisation. This slide is lifted from the annual report, and it just summarises a number of key achievements that were delivered across the organisation and their alignment with the health and care quality standards. This is quite a retrospective assessment last year, and what we want to do is establish a clear, consistent and proactive approach to quality to aid with our duty of quality compliance. And this, I believe, will be achieved through implementing the quality framework. The new framework represents a strategic shift in how quality is managed across DHW, and it mandates the creation of individual quality plans for product, services and supporting functions. The plans will be structured around Duran's trilogy covering quality planning, quality control and quality improvement. But they're also designed to align with both the health and care quality standards and the digital service standards for Wales. So we've written an SOP to guide the creation of the plans to try and ensure consistency and compliance. And each of the quality plans should include detailed mapping of activities within that team against the relevant standards, but also incorporating quality by design as a guiding principle and identifying critical quality attributes and establishing critical process parameters and key performance indicators. They're designed to be live-in documents that will provide a continuous record of assurance and compliance, but they'll also help to clarify roles and responsibilities and governance arrangements in each area, and thereby hopefully fostering a culture of accountability and continuous improvement through the organisation. Sorry, double click. So the implementation of the framework and the associated quality plans, I believe, offer significant benefits for the organisation. enabling proactive quality design and delivery, and moving beyond that reactive retrospective view that the last year's annual report primarily was. It will support deeper scrutiny and assurance by this committee, particularly in the way that they'll support our audit compliance. And some key initiatives supporting the framework will be some internal training aligned with the duty of quality, but also the 5-minute improvement work, the dashboard that is visible to all staff, and the initiative allows staff to submit their small improvement ideas, but also to be shared across other directorates. We're really encouraging staff to adopt improvements already registered by others, so we get some spread and scale on the improvement activity. And what we're trying to do is, with plans also, is to enhance transparency and traceability by documenting relationships between objectives and critical quality attributes, critical process parameters, but also OKRs and KPIs. And hopefully this approach will ensure quality is embedded in every aspect of DHW and promote continuous improvement, which is the ultimate aim of the duty of quality. This last but one slide really is just some examples from the quality plan. So we are pulling together an example of what good looks like, that with a few product owners and some supporting function heads as well. Hopefully what you'll see in the slide is for each objective, we've got a key result, the linked critical quality attributes and critical process parameters, and the KPIs and how they align to which parts of the duty of quality and the digital service standards. And then the bottom table is just hopefully a nice visual that lists each of the duty of quality functions and the digital service standards. So you can look at each objective and just make sure that across an entire quality plan we're mapping something against each of those standards to get a complete view. And then finally, just a few risks. So these are the risks that are highlighted both in this paper and in the quality framework paper that was on the consent agenda. Obviously, there's a non-compliance risk. So if we fail to implement the quality framework efficiently, then there is a potential reputational risk with non-compliance with the duty of quality. There's a resource and capability risk where some areas might lack capacity and capability to develop robust quality plans, but the quality team through the business partners will provide support in this function. And as I've already mentioned, we've developed an example of what a good quality plan looks like to aid people in their efforts there. And we're just looking to highlight some of the need for some effective monitoring and assurance from senior leadership and this committee, and executive support for adoption within the directorates to ensure the quality plans through the framework are embedded and maintained. And that's the end of the slides, Chair.
Diolch, Paul. Thank you very much for that detailed presentation. Can I just pick up, before I open it out, on your last slide and the risks? That's 5.1. You drew attention to, sort of the importance of effective monitoring and assurance, which will require sustained engagement from governance representatives and senior leadership. Can I just turn to the executive, perhaps to Claire and Chris? What steps are being taken to ensure that there is sufficient engagement and executive support in this area?
So shall I start, Chris? I'll pick this up. So from a exec perspective, as part of our SLT, so our senior leadership meetings, quality is on the agenda, and our quality business partners will attend those meetings and challenge us on our adherence to the quality standards. Now, those will depend on the ISOs, or the quality standards that each area has, so they are very variable across the organisation. And obviously when we have those independent auditors come in and look at our quality standards, we are part of that process where we are audited as exec leads to demonstrate leadership in this space. So so that is really how we primarily assure ourselves that we have embedded equality within our organisations and within our own directorates. And obviously we have our directorate reviews, which are about to take place actually internally, and quality quality compliance will be part of that review process, but with all the senior execs. But finally, I think the most important thing is we're trying to move away from a compliance mindset to more of a quality is just the way we work, which is culturally a big shift. And to do that, we are supporting that mindset shift with a couple of activities, including the 5-minute improvement plan. So it's really trying to shape our thinking around how do we improve, and how do we improve through through a quality lens from that respect. So that's really how we keep ourselves honest within DHEW at a senior level.
Diolch, Claire. That's very helpful indeed to get that clarification. Diolch yn fawr. I can't see any hands up for questions, so all that remains for me is to thank Paul for this deep dive on the duty of quality, which is very helpful in terms of giving the committee assurance of the work that's being undertaken. Diolch yn fawr iawn. We'll move on to agenda item 5.6, which is the corporate risk register. And I'd like to invite Chris Darling to present the update, noting in particular the 4 risks assigned to this committee. Diolch.
Diolch, Marion. Yeah, I'm going to run through the paper, and if time allows, I'll just quickly run through the corporate risk trending analysis for the committee as well. So there's 17 risks on the corporate risk register at the moment. As you mentioned, there are 4 assigned to the Audit and Assurance Committee. There are 2 that I've got just to reference before I go into those 4. One, Claire mentioned the digital inflation position, so that's something that we'll be monitoring from a risk perspective. And the other one, we've crafted a risk around the political environment. It didn't quite make it onto the risk register in time for the papers for this committee meeting, but it'll be assigned to this committee, so hence why I want to mention that now. The 4 risks that are assigned to the committee, there's 0207, the document management strategy. I'll just ask Paul in a moment to update on that. There's 0346, so the DDAC governance review implementation, and I updated on the rollout. We've kept that on the risk register until the substructure we talked about earlier is in place, and that we're confident roles and responsibilities across the national digital landscape are clearer. So that one's remained on. Then the other 2 are topics that we've covered through the committee today, but I will just reference them partly because I'm going to come on to talk about them in the risk trending. So 0331, the fixed term resource funding risk, and as Claire mentioned earlier, there's a resourcing subgroup, the task and finish group, sorry, that's specifically looking at that. And then 0337, the sustainable development funding model risk. So before I do the risk trending, I'll just see if Paul wants to update on the document management strategy, and then if Mark wants to comment on those 2 financial risks. Paul.
Thanks, Chris. So the document management strategy risk, I've last week downgraded that to directorate risk on the basis that we've had communication with our external auditor for the ISO 9001 standard, giving them an update on our progress against the non-compliances raised at the last audit, which they've now agreed to close. So I've left it open as a risk, but downgraded it because the project plan for the full completion of phase 2 of the document management strategy is currently at 91%. So there's still a few outstanding actions to complete, but from a risk perspective, the external auditor is happy now to close the non-compliances.
Thanks, Paul. And you did say the end of September, so bang on. Mark.
Yes, so just in terms of a quick update on the fixed term resourcing issue, the SRG or subgroup the SRG compiling a report, And as part of that report, it's going to be a bit more forward-looking. So instead of a static report in terms of the level exposure as we are 25-26, we're going to look at the future pipeline in terms of the skill requirements and the capabilities and how that actually tapers off into the next 3 years. So that's a piece of work that's currently ongoing. We are in discussion with Welsh Government. As part of that discussion, as Claire said, it's a 1-year profile in terms of funding. So I don't anticipate in terms of any sort of clarification or confirmation of future years funding as part of that discussion. But it is on their radar and it's part of the discussions that we have on a recurring basis with Welsh Government. In terms of the sustainable funding risk, as part of the finance update, we just have gone to the next phase of the service level agreements, recharging to make sure we have a sustainable base to provide our services. We also are in discussion with Welsh Government regarding the transition of programme into live services and ensuring we've got funding for services such as EPS, obviously NHS app from last financial year and cancer. And looking forward, we'll be looking at NDR's BAU requirements as part of that piece of work.
Thanks, Mark. Marion, are you happy if I move on to the risk trending?
Let's do that now then. Yes, thank you, Chris. I'm happy with that.
Thank you, Chair. I'll just share my screen and then I'll run through this. This won't take long, but it's just to show some of the trends over the last 12 months from a corporate risk register perspective, and just to recap a few things. So our risk and board assurance framework strategy sets out a committee assignment approach. So throughout the course of the last 12 months, corporate risks have been assigned to a committee of the board. As referenced earlier, there's 4 currently assigned to this committee. All corporate risks, when added, are done so with the approval of the relevant exec director lead for the risk. Corporate risks are reviewed monthly via our management board meetings internally. And I'm going to just focus as we go through the slides on the period October 24 to the end of August 25. During that period, deep dives have taken place on the corporate risks assigned to the relevant committees in those committee meetings. We did approve the board assurance framework in May, and that was linked to the 5 strategic missions that we have as an organisation. And today, as part of the risk work plan, we're just going to work through the last sort of 10, 11 months worth of corporate risks. So we started a snapshot position on the 1st of October 24. We had 14 risks on the corporate risk register. That's quite a low number, actually, in terms of how many are normally on the corporate risk register. But between that 10-month period, 14 risks were escalated onto the corporate risk register. 11 risks were removed or de-escalated from the corporate risk register. So movement remains fluid in terms of risks coming on and off the corporate risk register. What I just wanted to pause on was during that period, so it's a 10-month period really, from an audit and assurance committee perspective, 2 risks have remained on there for that entire period. So one is, well, actually, they're both the 2 risks Mark referenced earlier, and I think probably represent significant challenges for us organisationally, but was pleased to hear Mark mention the approach taking via the strategic resourcing group, task and finish group, that they're looking not so much as a static picture, but looking at the future pipeline of requirements and therefore trying to plan in what will be needed in the future to hopefully allow a workforce model that responds to that without such a reliance on fixed term funding. Obviously, the fixed term funding represents the fact the funding is non-recurrent, but we are doing work on that to try and address that, because certainly Claire will recall, you know, a year ago we were looking at a similar challenge around fixed term funding, and we're in the same position again now. The other risk, the sustainable digital services and development funding model. So this is clearly part of our long-term strategy to have a sustainable funding model in place, and the work continues to try and get to that point. Worth also just noting for the other main committees of the board where there's been risks that have been on the risk register throughout the entirety of that period, and we're going through the process of reviewing those at those relevant committees to understand if there's anything more we should have done during that period. I think it gives a good opportunity for reflection when they've been on that length of time. So this just shows some of what I've mentioned in graph form, and then we've assigned over the course of that period some of the risks and where they sit from a risk domain perspective. Probably no surprise, the majority of service delivery related. And then finally, we've also done the analysis from assigning the corporate risks, as we do when they go onto the board assurance framework, by strategic mission. So the majority being in missions 1 and 2. So mission 1, cyber information governance, a digital platform, and obviously mission 2 around our live service delivery products. So again, probably no surprises there, but always interesting, I think, to see what it looks like over the course of the 12 months or 10 months. So I'll stop sharing that. Happy to take any questions on any of that.
Thank you, Chris. Very helpful trend analysis there, and certainly informative, to say the least, to reflect on the shifts that have happened over the period. And those two ongoing risks for this committee represent, some of our most significant challenges organisationally, but good to reflect on the measures within our control that are being taken to mitigate those risks. I can't see any hands up. Can I just check whether there are any questions or comments? If not, thank you again, Chris, and very helpful stock take on our risk register. Let's move us on then to agenda item 5.7, which is the management of physical assets. And let me invite Cadwyn Lloyd-Jones now to provide the annual assurance report on the management of physical assets. Croeso mawr, Cadwyn.
Diolch yn fawr. Yes, it's a fairly brief paper, really. The way that we handle assets is currently slightly different between the two parts of the organisations that we've got, the one that deals with the desktop devices and so on, which currently uses a product called WASP asset management product for us, and the data center team manage things through spreadsheets at the moment. We've bought the licenses for WASP now for the back end as well, so we'll be settling on a common method of working, a common tooling for that. We have the same hardware sort of disposal processes in place across both of them, and obviously we comply with the annual sort of financial stock asset process that we have as well, and both teams carry out twice annual audits against, to check what we've got, where it's claimed to be, versus what it says in our back end systems. Yeah, that's it really. Any questions from anyone?
Thank you, Cadwyn. Any questions to Cadwyn on the asset management report? You've mentioned in your report, Claire, you come in then, please.
Yeah, no, just a comment really. This is an area that we've really strengthened over the last 4 years. And actually, it was really interesting. On the weekend, I had a text from one of my team to say that they'd finished the stock take and it was all 100% complete and accurate, which I think reflects really the comments in that report. So I welcome it. I think it's a really helpful assurance that we now know we've got a far stronger grip, supported by the IT system, understanding our stock levels, and we've got an active control process in place.
Thank you, Claire, for that clarity. It's really positive to hear that we've actually strengthened significantly our grip on this area. So thank you for that. Laura.
Diolch, Marion. Just a comment to thank the Operations Directorate, because committee members will remember we first took this report in private, and we've worked really hard alongside our colleagues to be able to publish this in the public domain. So it's just a thank you for their commitment to our openness and transparency to enable us to do that. Diolch.
Diolch yn fawr, Laura. Thank you. That brings us to the end of that agenda item then, Carwyn. Diolch yn fawr iawn.
Diolch yn fawr.
And we note the report for assurance purposes. And we'll move on then swiftly to agenda item 5.8, which is the Welsh language report, adroddiad yr iaith Gymraeg. And finally, last but certainly not least, I will now invite Laura to provide this report, which we're being asked to note, as well as to formally approve the Mwy na Geiriau annual report for submission to Welsh Government. Laura, diolch.
Diolch, Marion. So yeah, this is our routine report on Iaith Gymraeg, and committee members will note that this report also contains our annual report for Mwy na Geiriau. So this annual report documents our commitment to Welsh language across leadership, people development, digital services and cultural integration. Some key highlights to draw out from that annual report specifically include that 52% of our staff have at least level 1 Welsh language skills. 98.8% of staff have completed the Welsh language awareness course. Staff that don't have any Welsh language skills at the moment are attending the new courtesy level Welsh course, so we've got good progress in that area. And then also the creation of a best practice sharing webpage, Hub Iaith, and that has been developed in collaboration with the Welsh Institute of Digital Information. In terms of other areas to highlight from the report, I just wanted to focus a little bit, if I may, on our engagement and learning activities. So they're listed in section 4.2 of the report, and they outline the support we provide to our staff and wider NHS colleagues to develop and use their Welsh language skills. So as mentioned, we have a number of staff attending the courtesy level course recently launched, and also staff are supported to attend a confidence building course as well. We've hosted an internal back to school learning week in DHEW, which focused on using Welsh in meetings predominantly, which saw circa 200 members of staff join and engage with. And then lastly, to highlight, we have a number of events to celebrate Diwrnod Shwmae this month, which includes a session with Medied Ysgolion Maithrin, which supports staff who are learning Welsh, but also targets staff who either have children in Welsh schools or are thinking of Welsh education for their children. So we're hosting this session on behalf of NHS Wales, and we'll be encouraging all health body staff to join that one. In terms of the team, committee members will be aware that we've really focused on developing our DHW translation team, and we're really pleased and proud to have appointed a translation apprentice who joined our team in the beginning of September, and that also supports DHW's growing our own and putting people first principles. And then finally, it would be remiss of me not to mention that DHW have recently received a draft Welsh language standards compliance notice, and the detail of that can be found in section 5.2 of the report. So the development of this draft has been very much collaborative, where we've engaged closely with the Welsh Language Commissioner's Office in its development. So we're currently in a 3-month consultation period, at the end of which we will respond formally. There are some areas that require quite a bit of focused attention, but these aren't a surprise to us. So they're recruitment, communications, events and engagement. So we will work with key officers in these areas in particular over the coming months, and then we will of course bring our response and action plan to the next committee meeting for assurance. So a few things I wanted to highlight today, and happy to take any questions. Diolch yn fawr.
Diolch yn fawr, Laura. a very comprehensive report which highlights the wealth of work that's going on in this area, which is pleasing to note. The Hwb Iaith is a really exciting development, which I'm sure will have an impact on the use of Welsh language and the confidence of staff as well to access and use the language. Can I turn to the draft Welsh Language Standards Compliance Notice and appreciate that this is going out to consultation and that you will, following that, be developing an action plan. What's your level of confidence that you will have, that you do have the capacity to deliver on this notice?
Diolch, Marion. So I think we can say we're quite confident in most areas that we have the capacity to deliver on the compliance notice. Members will be aware that our Welsh language scheme has enabled us to operate as though under the standards already. So areas where I have sort of a bit of concern around capacity would be relating to service delivery standards, sort of in particular around service desk and corporate services being provided bilingually, and then also recruitment. So these aren't new to us. They're areas that you're aware that we focused on. So I think we'll have around circa 6 to 12 months before these will be imposed specifically on DHCW. So we will really focus our efforts in engaging in those areas in particular to increase our capacity there. So that'll be our focus, because I am fairly confident in the capacity in the other areas.
Diolch, Laura. I am aware that our Director of Strategy will be giving a session on in the Mwy Na Geiriau conference later this week, including some myth busting, which I think will be very helpful for the wider health and social care landscape. One final question, and you reference it in the report. Where are we with the Welsh language login for the app? Because this has been an ongoing issue and to a great degree outside our control. Do you have any latest intelligence on where we are with that, Laura?
Yeah, thanks, Marion. So we discussed this at our DHCW Management Board last month, actually. Helen, our Chief Executive, had a particular interest in the progress or lack of progress that we've seen in this area. So our latest is the team have currently drafted a letter which Helen is sending directly to her colleagues in NHS England, sort of trying to raise the awareness up to that chief executive level to try and get a progress update on that. I'll happily share that letter with committee members once it's been sent. So hopefully that'll gain some traction going forward. But that's the current position on that.
Thank you for reporting on that position, especially as the app is being sort of more formally launched and given a lot more profile over the coming months. It's just helpful to understand that we are putting pressure and highlighting this particular challenge for Wales with the lack of a Welsh language login. Felly diolch yn fawr, Laura, on that. So unless there are any other comments or questions, I propose that we approve the Mwy Na Geiriau annual report for submission to Welsh Government and note the draft Welsh Language Standards Compliance Notice, and we'll be coming back to this at our next meeting for sure. So thank you very much, and that brings us to part 6 and the close of today's meeting. I will work with Laura and the team to produce the highlight report to board. There are clearly some issues of escalation arising from the advisory audit on the culture and well-being, which we will escalate to board, and some positive recommendations arising from both the information governance framework audit and also a highly positive structured assessment, along with a number of learnings which we've highlighted during the course of today's meeting. But we'll work on that. Can I ask whether any other additional comments or observations from committee members? No? Okay, thank you very much. I've not been notified of any other urgent business in advance of today, so I will close the meeting now and want to thank my colleagues for all your contributions. It's been a good, positive meeting and thank you all for your engagement to Audit Wales and to internal audit as well for their input in making today a constructive and positive meeting. Diolch yn fawr, and the date of the next meeting is January the 20th, 2026. I will bring this meeting to a close. It is 12:15. Is there any issue that around starting the private session earlier? I propose that we start at 12:30, if that's all right with colleagues. Great. Diolch yn fawr. We shall see some of you shortly then, and we will bring the Audit and Assurance Committee to a close. Llawer o ddiolch a dyfol.